Senator Harvey. Okay, we're back live. This is Senate Health and Welfare. We're going to look at a markup draft, a new draft of S98 and see if we can make some progress.
Not a whole lot of change. So, again, Jen Kirby from the Office of Legislative Counsel. We are looking at S98, which is an act relating to Green Mountain Care Board authority over prescription drug costs. We had looked at a new draft a couple days ago, having the Green Mountain Care Board in consultation with technical advisory group and other state agencies, exploring and creating a framework and methodology for implementing a program to regulate the cost of prescription drugs. Told them certain things to look at. With this language, there was interest in getting a report.
Here, was there noise in here?
Yeah, but it's
gone.
There was interest in getting some more information sooner. Making progress with this. So this directs that by January 15th of 2025, instead of the board providing an update on the status of its work, the board will provide its preliminary plan for implementing the program and any proposals for legislative action needed to implement it. So you can make legislative changes if needed next year, as opposed to waiting to learn about them until 2026. And then in 2026, the board would provide its final plan for implementing the program, along with proposals for addressing any additional identified legislative needs. So if they come up with anything else, the goal would be to have a lot of the legislative needs figured out before next session, so that we can make them. So that's it for the changes.
Okay. Questions for Jen? Been through this a few times. Mark, Senator Gould, do you have a question?
I don't think we talked.
No, I don't, not at this time.
Okay, so we're getting to the end on this bill. Is there anything more that you think should be included in the draft or modified? So what I'm going to suggest is that we go through the bill from start to finish, sort of the what's in each section. Because I know you are out of time.
Yes, and some of it is a lot of words.
If you're moving towards vote,
Damn.
the bit I haven't heard is the return on investment. With this dedicated money, what's the anticipated savings? Until that, I'm not gonna vote for a bill that I can't, I don't understand the return on investment. It's really that simple.
I think,
I like the premise of the bill. All right.
So that is one of the items for report, but it's not anything that, I don't think it's anything that Nolan is gonna be able to tell you
no,
in advance.
it's in the report.
So, I mean, that's one of the things that they're, and what,
Can you go down to the money section?
Doesn't come out of the general fund. It comes out of a dedicated fund.
yes, right.
First account, it's treasury, state money. Whatever bucket of money it's coming out of, it's dedicated money. And I hesitate on any bill, not this bill specifically. To vote without knowing what the ROI is. To me, that's how we make business decisions across the board. And so I know that's my hesitation. That's all. So
Okay.
You've known that.
No, I have, but we've also had testimony on that from Jane Horvath and Dr. Stovall. So I think go back and look at that testimony, see if there's anything there that reassures you or not. And then, Jen, can you talk about the financing piece, and maybe Nolan can weigh in?
Sure, I mean, the appropriations in the bill are $495,000 split between the positions. There's 2 new positions created for the board, and for them to contract with experts to help design this. The money comes out of the evidence-based education and advertising fund, and that is the fund that is fed by the manufacturer fee, the fee on manufacturers of prescription drugs for manufacturers participating in Vermont's Medicaid and other benefit programs. And that money is used for certain kind of prescription drug related.
I recognize all of that. It's all old news. So looking for assumptions and a number.
I think the only way we can do that is by looking at what other states are, what's happening in other states. So we've got Colorado and Maryland. We've had testimony on their progress, and we may not know the return on investment until two things happen. One, the board completes its work and analysis, and that would be including what's happening in those other states. So I think that's what we are. Do you have time to go through?
I mean, I can go through and on high level.
Yeah, what I'm gonna suggest is we come back to the bill in the morning, keep you put it on, we'll have time for that.
Do you want me to do the highest level version?
If you
just remind me what's here. Sure. So as I mentioned, has the board explore and create a framework and methodology for implementing a program for regulating the prescription drugs. Directs the board to consider options for and likely impact of regulating the cost, including experiences of other states that have developed prescription drug affordability board, the development and operation of the federal Medicare drug price negotiation program, other promising federal and state strategies for lowering prescription drug costs, board's existing authority to set rates, adopt rules, and establish advisory groups, the likely return on investment of the most promising program options, and the impact of implementing a program on other state agencies and on private sector. Then there would be that preliminary plan in January of 2025 and a final plan in January of 2026. It creates two new positions at the board to lead the exploration, development, and implementation of the program, a director of prescription drug pricing and policy analyst. It appropriates $245,000 to the Green Mountain Care Board from the Evidence-Based Education and Advertising Fund in FY25 for those positions. Gives the board legal assistance as needed from the Office of the Attorney General and appropriates $250,000 to the board from the Evidence-Based Education and Advertising Fund in FY25 to contract experts. Sections 2 and 3 then add the Green Mountain Care Board's prescription drug cost regulation initiatives as allowable uses of the Evidence-Based Education and Advertising Fund, one in the description of the fee and one in the language on the fund, and limits the use of the fund by the board or to support the board's prescription drug cost regulation initiatives to $1 million per fiscal year, so no more than that. In this case, I'm not appropriating that much.
Good, so let's keep this draft for the draft that we'll consider tomorrow, and we'll put it on our agenda for tomorrow morning. I will say, I did write a little op-ed about this, and I maybe should have, because it does look at some cost increases that we're facing. You have to go. Can you be available tomorrow morning? Okay, that's good.
And I wanted to thank Nolan for sharing the marketing,
The fund, manufacturing.
I appreciate that.
Yeah.
Thanks.
So, before we move on to Katie, I'm looking at the board here, so do you want to make a comment? You want to come up and comment, in particular on the question that Senator Weeks has had, and how you calculate savings or, perhaps cost reduction in other areas? How's that considered? Because we do have a big investment in the board, and then we expect to get some return overall in the healthcare system, so maybe we could just.
I might have Julia add in.
Huh?
My technical advice behind you.
Oh, good. Okay.
Susan Barrett, Executive Director of the Green Mountain Care Board. I hear you on the ROI. I think we look at that in all the work that we do. What are we putting into any endeavor? And whether it's regulation or healthcare reform activities or something like this. And I believe, and I don't have the language in front of me, I'm sorry, I think one of the items we will be looking at is the return on investment, of a model if we would go forward with one, and our eyes will be on that area. We do have some alternative language, but it's very similar to what Jen
I just,
shared.
yeah,
And I'm wondering if that might, that it's regarding the Medicare, negotiations and we could, I think we shared that with you and that might
I
help.
didn't get it till late, so,
Yeah, no, we sent
I'm not
it late
even-
yesterday,
yeah, okay,
so that might help as well.
okay. You wanna send it to Kiki, send it,
We sent it yesterday.
and we'll look at it,
So I hear you. It's important every dollar we spend. It's Vermont taxpayer dollars. And so we are a fairly lean machine at the Fremont Care Board and we take every effort to ensure that we are good stewards of Vermont's and all of our taxpayer dollars.
yeah, for me, it's just like, if you're gonna have a new initiative, this is a new initiative, no question about it. And we've identified some funding that is coming from the pharmaceutical industry, and it fits with what's in the bill. If you're gonna start something new, you've got, it's like startup business funding. And then a decision about, is it worth going forward? So I think we're at that stage. It's like doing your sort of going out and doing market analysis and whether you want to do it, and then how much you need to invest initially for starting. So that, I think that's what we are. But we are seeing work in other states, and there are experts out there who have weighed in. And it is one of the huge cost pressures right now in our healthcare system. It's just unfathomable. 500% increase in Humira since its introduction. And for people who really needed it for arthritis, and now it's expanded to other uses. Just not fair to the consumer. We'll look at the testimony and think about it. That's all we can ask.
I don't want to leave you with the impression that I'm critical of the Care Board.
No, I'm not
Really
hearing that at all.
This
Thank
is,
you.
this is a business proposition from the perspective of the state. Either it makes sense or it doesn't make sense. And it's so crystal clear. I haven't seen the data in the past 2 months. That's all. But again, I'm not being critical of your mission and your achievements.
I hear you on
No.
that. Thank you.
Okay. Any other comments around the room? And then we need to move on to 231. Next one. All right, good, thank you. So Katie. 231 is one we haven't looked at very much. What I'm gonna suggest is. We'll look at it. We'll just keep on. In order, but I'm gonna keep us to a time frame, because you're just a little bit late.
Good morning.
Good morning.
Hey, I've been up to legislative council. I will pull up the amendment for 231, and then I will just refresh your memory briefly as to where we were. So 231 was the community nurse partnership bill that you looked at and taken testimony on. And this is the first time you're seeing a proposed amendment to that bill. So this is a strike all amendment. And instead, the bill would read this, that there would be a request for a fiscal recommendation. So by November 1st of this year, AHS, in collaboration with the Vermont League of Cities and Towns and Community Nurse Partner Programs, shall submit a fiscal recommendation to the Appropriations Committee from the Policy Committee is proposing a fiscal mechanism by which municipalities seeking to partner with a local community nurse partnership program may pledge municipal funds to draw down a state match for the program's operation. And then it would take effect July 1, so this would be a replacement of the existing language.
So it goes from implementing and having, forget the original amount, so let's see.
Value. 231. 450.
$450,000, which. And then some, but we did hear that there were municipalities with funds available that could participate. So. I'm fine with this language. Any thoughts? Any thoughts on this? We haven't heard from the VLCT, but we've heard from various municipalities, so we just expanded.
So I recognize this was a strike all. Is there a money section
No,
retained in this?
no, this is it. It would just be sections 1 and 2.
This will go down the hole. It will go to appropriations, but there's no money here. It's asking for a fiscal mechanism to put community nurses in place. Right now, it's funded through donations and, what?
I love the concept.
Yes,
I think it could work so well if you had the people who want to participate.
Right.
so, okay, so will, Senator Gulick, any questions on this?
No questions. I think it's a great bill. Thank you.
Okay. So I think what we'll do is we'll hold our vote off until tomorrow morning, Katie. We'll put 231 on again tomorrow and then we can, see where we are. Okay. All right, what's next? 186.
Pull that one up. Okay, so S-186, this is a recovery residence bill. If you remember, we walked through the bill yesterday. The committee decided on some changes and those changes are in this new draft. So why don't I first start by just highlighting where the changes are, and if you want to go back through them.
Let's do the changes.
Okay.
Yeah,
The changes are all highlighted in yellow on page 2. This language said, including staffing, training and supervision, so staff training and supervision, so that's correcting a typo. And then in section 2, this was the assessment on recovery residences. The lead-in language has been changed a bit because you asked for a report back by a certain date of the assessment, but you never had language actually directing that the assessment be done. So there's language directing the assessment to be done and then directing technical assistance. So the Department of Health shall complete an assessment of recovery residences in the state, and conducting the assessment it shall obtain technical assistance for the purposes of. And you'll notice that shall obtain, the previous language had been contracting with, so by saying shall obtain, removed language asking for an appropriation for this, as the department, I believe, has indicated that they could work with an entity free of charge for this technical assistance. In subdivision B, building sustainable funding with a focus on developing fee structures. This was to correct a problem where we had duplicity, where the lead-in language talked about having technical assistance for technical assistance. So we've removed that duplicative language. And now the phrase starts with building sustainable funding with a focus on developing fee structures. And now here is the language that you asked for regarding a date by which the assessment would come in. So on or before October 15th of this year, the department shall submit the results of the assessment required pursuant to this section and any recommendations for legislative action to the two policy committees. Numbering B to BC, and then the reserve, the opioid settlement advisory committee reserve. You've made some changes so that it's a consideration of reserving the money and that it's for an annual grant program. You're no longer saying anything about technical assistance.
Yeah, we don't
So-
want to tell the advisory committee, we don't want to intrude into that process, but it's a suggestion that they consider that.
So the full paragraph is that in developing its recommendations for expenditure from the opioid abatement special fund. The advisory committee shall consider reserving $500,000 annually to establish a grant program for recovery residents' capital expenses. Those are the changes you discussed yesterday.
So. Questions?
So who? I like the bill. Who's gonna provide oversight on this process? VHS.
But the Department of Health
Okay.
will be working, and again, they've been working on this right along with Fletcher Group and recovery residents using the state, so they'll continue that work. But they asked to have some. Guidance. Go ahead.
I don't think we should have that language in about the opioid settlement committee. The opioid settlement committee needs to be able to do this work without getting pressure from the legislature. Where the committee just advises the legislature and then the legislature can do whatever it wants with the funding. But I think having this in here is an undue it's an inappropriate sort of suggestion from the legislature, so I wouldn't support having that in here. Okay.
Any other questions? Senator Gulick, do you have any questions or comments?
No, I don't. Thank you.
Okay. So, the reason for putting that in there is right now, in conversation with others, right now, should the assessment piece and everything else come forward, having some advanced thinking about what's required. So we'll be getting the information back, and then the legislature will be making decisions about how to go forward. But if the opioid settlement committee is looking at how to put in place, how to help put in place IT improvements or other capital improvements, then it'll be, we're be ahead of the game. So that's all that's just
The
advice.
opioid settlement committee, opioid settlement fund is not really supposed to be for capital expenses either, so I just all of section 3. I think
Actually, I
needs to come
talked
out
to the
of
commissioner about the guidance.
I think that section 3 should come out of Phil. I don't think that's an appropriate thing to have.
Well, we could think about that. Let's think about that. So Katie, let's go through the whole bill and see what's here.
Sure. So to refresh your memory, this first section is about a recommended recovery resident certification program. So in subsection A, you're directing the Department of Health in consultation with state agencies and community partners to develop and recommend a certification program for recovery residences operating in the state. The certification program shall incorporate those elements of the existing certification program operated by VTAR. The recommended certification program shall also identify an organization to serve as the certifying body for recovery residences in the state. Propose certification fees for recovery residences. Establish a grievance and review process for complaints pertaining to certified recovery residences. Identify certification levels, which may include distinct staffing or administrative requirements or both, to enable a recovery residents to provide more intensive or extensive services. Identify eligibility requirements for each level of recovery residence certification, including staff and administrative requirements for recovery residences, including staff training and supervision. Compliance with industry best practices that support a safe, healthy, and effective recovery requirement. And data collection requirements related to resident outcomes. And establish required policies and procedures regarding the provision of services by recovery residences, including policies and procedures related to resident rights, resident use of legally prescribed medications, and promoting quality and positive outcomes for residents. In developing the certification program recommendations required pursuant to this section, the department shall consider available funding streams to sustainably expand recovery resident services throughout the state. How to eliminate barriers that limit the availability of recovery residences and recovery residence models used in other states and their applicability to Vermont. By October 15th of this year, the department is to submit a written report describing its recommended recovery resident certification program and containing corresponding draft legislation to the House Committee on Human Services and to the Senate Committee on Health and Welfare. And then we have a definition of recovery residence. Section 2 of the bill moves from the certification piece to the assessment. So as we already talked about, the new lead-in language is that the Department of Health shall complete an assessment of recovery residences. And in conducting the assessment, it shall obtain technical assistance for the purposes of creating a comprehensive inventory of all recovery residences in Vermont, including assessments of proximity to employment, recovery, and other community resources. Assessing the current capacity, knowledge, and ability of recovery residences to inform data collection and improve outcomes for residents. Assessing recovery residences' potential for future data collection capacity. Assessing the types of data systems currently in use in Vermont's recovery residences and defining the minimum core components of a data system. Assisting to develop a framework of critical components and measurable outcomes for recovery residences and other recovery communities. Assisting with capacity building and sustaining alternative payment models for recovery residences. And lastly, building sustainable funding with a focus on developing fee structures. And as we noted that this assessment would be due on October 15th, the department is to submit the results of the assessment required pursuant to this section to the policy committees and any recommendations for legislative action. We have the same definition for recovery residents here. Section 3 is the money pertaining to the opioid settlement advisory committee, and then section 4 is our effective date.
Okay. So the suggestion has been made to take out our recommendation to the advisory committee. The concern that I had was if the report's coming back in October, then, and the advisory committee is meeting, then they can make some considerations of what might be in the report. And to the use of, so sort of, I think of it as kind of reserving that money over time and have it be a rolling fund that is acceptable within the guidelines. My biggest concern is it not be utilized for ongoing operational expenses. So that's where the word capital came from. So if there's a way to put the recommendation in there asking for, we don't have to say shall, would request consideration of reserving to the advisory committee, then it just puts it on the list of things to look at. And then take out capital and say grant program, but will not include ongoing operational expenditures. So it would get maybe to the same place where we're looking at some initial investment in IT or other things that recovery centers might need in order to fit up and go forward. That's what we said.
I think when this report comes out, the opioid settlement advisory committee will be meeting and we can take a look at the report. I don't think it's appropriate for the legislature to be telling that committee what to advise the legislature on. And
Or not,
it's
I
saying,
think it's just saying consider that.
yeah, I think it's, I think that all of section 3 isn't appropriate and isn't necessary. The opioid settlement committee should be able to make the recommendations based on the testimony and the work that they do, and then the legislature can choose to follow the recommendations or not. But I think having the sort of, something getting to the front of the line is not necessarily a helpful thing. The recovery residents came in and did a presentation, and frankly, it was pretty weak to the opioid settlement committee. So that if they want to make their case next time, I think maybe the report will help them.
This doesn't come from them, this comes directly from an idea that I had about ensuring that we had some funds available for whatever needs to happen with them going forward. Senator Weeks.
Do we lose anything if we strike section 3? I mean,
Well, we lose the idea, it's an idea that no one else has thought of until I brought it up with the commissioner with Monica Hutt, in July, so.
Okay, but the report would contain all kinds of recommendations.
Yeah.
How to move forward.
Yes.
Which would then be utilized by the opioid fund advisory group, works to that effect. But again, if this is this is a speed bump or stumbling block passing this.
No, I'm fine. I'll send a letter. So Senator Gulick, any thoughts on section 3?
Not really, except that I feel like I want to defer to the folks who are actually on the opioid advisory committee. They know more than I do, so I guess I sort of trust in what Senator Hardy is saying, because she was on that committee, but I will, I'll keep trying to learn and.
No, that's fine, that's fine. I'm not so invested in this that we have to keep it. It's an idea for ensuring that there are funds available. So I think in particular about a place like Gemma's Promise, and if you're gonna do a startup, there was a lot of fundraising that they had to do before they could begin. This would have some, and they're right now under a pilot program with a grant of $500,000, but and one of the motivating factors of the bill is to try to sort out what benefits we're getting from that organization because of the family and what we're getting as a result of the work that's going on. But having the funds available for a place like Brattleboro, for example, that may want to do this, that there might be funds available. Well, we don't have to include it on that. I will be wedded to that.
So I'm not familiar with the opioid
So,
committee.
oh, yes,
So, would there be possibilities that they might allocate some of that money to this organization?
Yeah, I mean,
Without being told to do it?
the committee does what this committee does. It takes a lot of testimony and considers a bunch of requests and priorities, and then prioritizes what they want to recommend to the legislature. I mean, and recovery of residents is something that we've considered in the past, and I think we certainly would, especially if there's a report coming out. I just think the language is attempting to put this thing at the head of the line in an inappropriate way, and having the legislature butt in a part of the process that they should have butted.
and you're right. So one of the reasons that we passed the legislation in the first place was, according to the guidelines, the legislature does not have to be involved in decision-making about the use of the funds. And in other states, it's totally in the governor's office, it's totally executive privilege how to use that money. And so in passing the bill, we said, no, we want to have a role, but we put the role in through the opioid settlement advisory committee, which is only advisory because according to the guidelines, it can't be definitive. And so So we're already engaged in that. It's just the thought of having some funds available. And I'm happy Xing it out and we can move ahead without it. Not a big deal.
Personally, I think you still accomplish everything you want to accomplish.
No, I think so. Yeah, I think you're right. It's just nice to know there's a landing place. So Katie, how difficult is that to do? Renumber effective
It will
date?
be very fast. If you want it right now, I can do that.
Let's do this. Let's look at, okay, start doing that and I'll move down to Office of Health Equity that you'll see on the agenda. So I had a communication from the executive branch, the governor's office, about where the Office of Health Equity should be placed. It's currently over there on the fifth floor, and they sent a note out to me and to Lori Houghton, and I wanted to poll the committee about this. They're suggesting that the Office of Health Equity be moved to the Department of Health. And I think it sounds like a reasonable idea, but I thought I would poll the committee about that before responding.
What other options?
Yeah, it's in the governor's office. Right now, their function is being more with the Department of Health. Some of the equity issues.
I would just say that I'd like to hear more
I can
That's
show
really
you. what-
before we make any kind of, I'd like to hear from the Office of Health Equity people.
Oh, they're supportive, and it's,
Well, I'd
I'll
like to
send
hear
you the letter.
directly from them and before I weigh in on it.
Okay, we can do that. Okay, we'll have. I think it's Marquise.
Is it in our wheelhouse to even make that?
No, it's just, they can do it. It's just,
Maybe they could, it's an executive position inside the
yeah,
executive
it's an
branch.
executive branch making an executive decision, wanting to come.
Well, I mean, the legislature weighs in on the structure of the executive branch. I mean, that's part of what we do down the hall in GovOps, about how to structure departments and agencies and things like that. So I think it's appropriate for us to say what we think, but I also just don't want to do it in a vacuum without hearing more information about
Good,
what
that's why I
the
brought it
situation
to the
is.
committee.
There was a reason it was put where it was to begin with, and
It was because Susanna Davis was there and we didn't have a clear place for it. That's what.
And what levers get pulled to make this, if it pans out, you agree, to make this change? Is it good? Is it bill? Who is it?
Just, so I'll get that letter and we'll have someone in next week to talk about it. The House Healthcare Committee, simply said yes, and everything, what we'll do. Okay, so Katie, do we have anything?
Yeah, so just something to keep key, you wanna put it up on your iPad, so the resident can just share from my Word document.
Okay,
Is that fine?
yes.
Okay. So, this is draft 3.1. You have your section 1 on recovery residence certification. Your section 2 is the assessment. You've removed the former section 3, so now section 3 is the effective date section.
Okay. Any questions? Are we good with this?
It's good.
Okay. Do we want to vote on this now, or do you want to hold off till tomorrow?
I move that we,
Hold off till tomorrow.
oh.
Yeah, do you want to hold off till tomorrow, Senator?
Only
But-
I want to do my duty as clerk.
Okay,
I was gonna cover for you.
We could have cover for you.
Terry was excited to fill out the paper.
I'm an expert.
If you all feel strongly about voting today, that's fine.
Oh, we can wait till two.
No, well, that's good. Okay, we'll do that tomorrow. We're gonna have a lot. So. The proposed amendment we talked about yesterday regarding violence with, home health. Caregivers. Katie has worked something up for us. So, glad that goes with that.
Okay. This is the amendment being offered by Senators Lyon.
So just to clarify here, that there are three names here, and if you decide going through it.
Yeah, no, I understand. I've been tracking this.
Okay. Okay,
I'm
all
all ears.
Okay.
right, go ahead.
So to remind you, S-189 is your bill that pertains to mental health, guidelines, crisis response guidelines. Social worker safety working group, I shouldn't call it a working group, a group to meet and provide recommendations. So this would be adding a third section to the bill, about, home health agencies and when a home health agency can decline, service if a member of the staff has been, at risk, previously. So what this language does is it adds a new section in the home health, chapter. If an individual was previously discharged from service by a home health agency to protect the safety of staff in accordance with the rules adopted by Dale pursuant to subsection 6303A of this chapter, and the behavior or conditions causing the discharge cannot be mitigated or eliminated, a home health agency may deny a subsequent admission or decline to send a home health agency employee to make a visit if the home health agency has reason to believe that the individual who exhibited the behavior that resulted in the discharge is present in the home. And then we're renumbering the existing effective date section from 3 to 4.
Okay, questions?
Yeah, I understand the purpose of the amendment and I support the idea. I just found the language in line 13 and 14 a little bit wonky. And I wanted to just understand that the reason why it says, has reason to believe that the individual who exhibited. So I think the concept is that, it doesn't need to be the patient. It could be related to the patient. And, there's some sense of risk for the visiting, medical professional. Is that really why it says believe that the individual who exhibited? Just a little bit.
I agree that the language is a little awkward, but that is the concept, that it could be, a son or an aunt or somebody who's lived
So,
there that's.
Doesn't say anything about a dog. And
So-
that's the example I carry around my head.
Yes,
So, or the condition.
Individual could not be a dog.
Individual cannot be,
Oh.
or kitty. Cat, lion, or pet tiger.
conditions. So I'll add my sport to it. I just found that.
Yeah, no, we,
at
so
13.
Close.
can we put something in there about the puppies?
You could say, sorry, I'm trying to put on the spot, has reason to believe. Individual. They hear.
Dangerous conditions or.
Well, we have conditions
Yep.
in line 9 and 10. You see that? And the behavior conditions causing the discharge cannot be mitigated or eliminated.
Okay, condition could be a dog, okay.
But,
But,
like if the dog is present, is still present, number 2 wouldn't cover that. It would cover an individual who is not could be the patient, but it's not necessarily the patient.
Maybe reasons to believe that the behavior or conditions causing the discharge are still present.
Can behavior still be present?
That's true.
The
Have not been corrected.
the behavior.
Not
or
really sure.
the behavior conditions not been addressed.
Yeah, but that's what it says on line 9. Okay. So I'm just, I don't really understand the difference between 1 and 2. The whole idea is they may deny the subsequent visits.
Right.
I don't wanna re-prosecute the bill, but, you know, thinking about it from the patient who has obviously got a need. You know, what do they do when BMA or whoever calls up and says, hey, we're not coming back because somebody's gotta take care of that patient.
One thing I did, I hear you, I have a similar concern, and I have concern about the safety of the people, so it's a tough situation. I mean, we dealt with this last year with the emergency room bill. and- Yeah, so it's really unfortunate that our society's kind of come to this place where there's so many of these happening, but I did ask yesterday of Jill Olson, about whether or not, just confirmed, I was sure it was the case, but just to confirm that whether or not, home health workers are, mandated reporters. Because I was concerned that if there's an individual in the home that's threatening a home health worker, they could also be abusing the person
Correct.
who's the patient, and that's also really problematic. And she did say they are mandated reporters and that they would file a report about that. Now, presumably that would mean that DCF or Dale or somebody would get
An
involved.
investigation.
There would be an
Well,
investigation.
the report could take days.
Exactly.
Say,
So,
phone
yeah.
call would be, hey,
Get rid of the dog.
we got this problem.
Fix this stuff.
And we're gonna leave the patient, we're not going back to, so let's go leave the patient without.
Okay, so are we good with this, or do we need to do anything for improvement at this time? Remember, it leaves here and will hopefully we'll
That's
also
what
send.
you can have my answer.
Yeah, we
Okay.
might
Just
just,
found the,
Okay, yeah, no, the wonky language. Okay, let's put us all on there. That would be-
not that you normally use funky language.
Sorry.
very atypical.
Where was the dog? I was thinking about this bill last night, and I said, that is such a good example of how this, how you could fix.
Well, I don't think the dogs are a big
No.
problem right now.
But it
It's
wasn't his
people
fault.
who are
Yeah,
doing
it
it.
was a problem.
It was a big problem.
That's a dog saw a mom deteriorated, very territorial, trying to protect it.
Of course.
It's our problem to solve.
So, and Kiki, we're good with that, right? Do that, maybe we can, we have to get
to,
once we have it and everybody's okay with it and on it, then I'll just take it upstairs for today, it'll be on.
I'll send it to you right now.
You can handle. You can handle it.
Yeah, no, it's lined up tomorrow. Happy to step in.
Yeah.
Okay. Okay, why don't we hand that around? And I don't know that you want to act on this today. This is the letter from the office. Kristen Murphy and Mark Hughes are the co-chairs of the Health Equity Advisory Commission. And the memo, the email that I received came from Sean Brown in the governor's office supporting this request. So you may want to look at this and then decide, do we need to take further testimony? I'm not suggesting that you act on it right now.
Is this posted?
Oh, no, it's not. It will be.
It is.
It is posted, Senator. You can refresh probably and get it.
Great, thank you.
This is not a time critical like today.
No. And we had important conversations last year regarding funding of the office.
It sounds like there's a report that they presented to the House Committee in early February.
Mhm.
Might be helpful for us to get that same presentation so we have context. I
Okay.
mean, especially because 3 members of the committee weren't around when we set this office up. Years ago.
Who keeps track of,
It's up, well, it's already on our page.
who keeps track of
The reports?
requirements?
There's a person in, joint fiscal. Is it Sorcia Anderson? Who posts for us, and then we get all the reports on our page. So this one will be there. I think I'm at the 23.
So if somebody didn't get reported, they would take care of notifying them that they were.
Maybe, maybe not. Yeah.
Yes.
So we'll hold that letter, you have it, and look at it, and then we'll try to. Yeah, we'll discuss it, make a decision. Do we have something to vote on?
Oh,
We don't have to vote
we
on.
were
the
waiting,
amendment.
yeah,
No,
no,
I'm
just
just waiting
vote on
for
it.
some
I,
copy of
it's been emailed to you and Kiki.
Okay, we're good. So that's a wrap. We're good for the today. We got 100 things to vote on tomorrow. Not quite 100, but close. I don't like sending so many bills out on the last day, but I think sometimes it's unavoidable. And we'll move on. So the bills that are not yet. So we'll come back tomorrow and look at, in particular, I think especially the ones that we just finished, 186 and 180, we're doing 189. And S98 in particular, I think they're critical for us to think about. I think 231 has a long way to go. I'm not sure. Well, we have 231 to vote on. I apologize, wrong number. 263, which is the International Medical School. We can have a conversation about that tomorrow. I don't know if we can make improvements without further. So,
If we want to avoid voting on the last day, I'm honestly fine with us voting today. Especially since there's 15 minutes left before noon. All right, why don't you guys go ahead and do the vote?
okay.
Yeah.
So we can vote on 186. I'm gonna suggest we hold off the vote on 98. Okay, so let's vote on 186. We do that? It's our motion out there.
I'll move that we report favorably S 186.
Okay. Okay, the motion's been made to send favorably 186 to the full Senate. Which draft is that?
3.1.
3.1. Okay. There she is. So we will have the discussion. Clerk, please call the roll.
Senator Gillen,
Yes.
Senator Hardy,
Yes.
Senator Williams, yes. Vice Chair Weeks,
Yes.
Chair Williams,
Yes.
5-0-0.
Okay. Yes, I will go. Okay. And I just see the co-chair of the Health Equity Advisory Commission is here. We have a few minutes. So would you like to come up and talk with us about the request to move the commission to the Department of Health?
Thank you, Madam Chair. For the record, I'm Kirsten Murphy, Executive Director of the Vermont Developmental Disabilities Council. We are located in AHS Central Office as an independent.
AHS, you got.
I'm sorry, Agency of Human Services.
No, but I remember there was a period of time when you were over there.
Yeah.
And now it's moved over there.
Yeah. So, well, we are an independent board and committed to come and speak to the legislature and on behalf of our council. So I am also the co-chair of the Health Equity Advisory Commission, which is an entity that was created by the legislature. I rushed over here, so I didn't get to check my dates, but at least 2 years ago. And the original request to the legislature from advocates who work in the health disparities space was that we needed an office to oversee addressing health equity. And the legislature said, we're gonna give you an advisory board, and your advisory board has the job of figuring out what the charge of that office will be and where it should be located and what resources it needs. I'm gonna provide 2-3 sentences of background. The Centers for Medicaid and Medicare Innovation, CMMI, you have heard are sort of seeking states that want to participate in the AHEAD model. One of the core tenets of that, and I know that there are debates about some of the governance of that, but one of the core tenets of the AHEAD model is the need to lean into health equity because it is central to improving population health. And that wasn't understood well even 5 years ago. Equity was not put forward as sort of one of the most important things we needed to do in healthcare reform. And now our federal officials are saying that it is. So I think it makes it all the more urgent that Vermont have an office that can implement across government systems efforts to address the health disparities experienced by typically people with disabilities, people of color, and individuals who are in the LGBTQIA community, but also there are other identified disparity groups. Anyway, to go back to the Equity Commission, we have produced several reports and really leaned into the most recent report, which I authored. And we were asked through the budget bill last session that we were told if we wanted some money for the office, we must provide a clear recommendation about where the office should be located. We struggled as a commission to reach a conclusion because there was a real tension between folks that wanted to see it in a health department and folks that wanted to see it in a more global type location within government, because we believe in a whole of government approach as being necessary. When we think about the social determinants of health, health is determined by housing and transportation and all kinds of other parts of government besides the Human Services Agency and its departments. We created a spreadsheet. We looked at the pluses and minuses of 5 different locations for the office and came to a consensus as a commission that during the startup of this office for 3 to 5 years, it absolutely belongs to the Department of Health, because we need the resources and expertise of our partners in the Department of Health, who are all public health officials and educated in that field. That might not be the best decision forever, but it's absolutely the right decision for now. So we are asking and providing the recommendation that that office be located in the Department of Health. That will trigger the release of a small amount of funding. It's $250,000 to hire a director and begin to stand up that office. We also worked really hard to build a bridge with the Department of Health that understandably wanted to know, well, we got supervisors, new thing, what do you think? So we had to get buy-in from our colleagues at the Department of Health. The commission is it's a related and advisory entity to this office, and we think It's currently located in the Agency of Administration. That too might need to migrate, but that's another conversation. Today you want to know, does it belong to the Department of Health? And there is a strong consensus on our part that it does, and also, House Health Care has concurred. I'm happy to answer any questions.
Questions?
Has is there anything, do we have anything in writing that the commissioner and the Department of Health concurs with having a new?
You have that report, I know, they actually didn't produce something in writing, I'm certain that we could ask the commissioner to provide that to you. It is in our report, which was filed in early January, but again, the commissioner signed that.
I also think it would be more convincing if you left out your spiel about the AHEAD model as of one of the driving factors, not only because the AHEAD model is somewhat controversial, but because health equity should be a thing that we care about regardless of what the federal government is telling us.
Well,
I think having it, because we as Vermonters and because the legislature has said this is a priority and that we know that the data supports it.
I apologize if that was impacted.
No need to apologize, it's just a
No,
sore
well, the
subject in this
well,
room.
E stands for equity, so I think it probably fits. Any other questions?
And
one of the
your report that,
February,
you know, I don't think we've gotten any kind of
You have not, we've
presentation
we've
on,
offered to do that and would be happy to provide that.
that would be great, I'd love to have that.
so we do have an annual report, January. Okay, so we have your comments, we have your letter, and we'll follow up on this probably next week or so.
We appreciate that. And
Yeah.
again, happy to bring the commission first.
So, and just to confirm, this doesn't have to happen tomorrow.
No, we would like to advertise for the director position,
Got
and the administration is telling us that you need written concurrence from you.
Okay. All right. Good, thank you. So,
We missed it?
yes. Okay. Is there anything else? Have we done everything? Katie, we've done everything? We got the amendments. So we are going to now. We're gonna